A lot of you know that a significant function of the kidneys is to remove waste products and excess fluid from the body. These waste products and excess fluid are removed through the urine. The production of urine involves highly complex steps of excretionary absorption. This process is important to preserve a stable balance of body chemicals. Anatomy. The two kidneys are located to the rear of the abdominal cavity on either side of the spine. They normally weigh about 5 ounces each but receive about 20% of the blood flow coming from the heart. The urine produced by each kidney drains through a separate ureter into the urinary bladder located in the pelvic region. The bladder is emptied in turn by a single urethra which exits the body. Where are the kidneys and how do they function? There are two kidneys, each about the size of a fist, situated on either side of the spine at the lowest level of the rib cage. Each kidney contains up to 1 million functioning units called nephrons. A nephron comprises of a filtering unit of small blood vessels called a glomerulus attached to a tubule. At the point when blood enters the glomerulus, it is filtered and the remaining fluid then passes along the tubule. In the tubule, chemicals and water are either added to or removed from this filtered fluid according to the body's needs, the final product being the urine we excrete. The kidneys perform their life-sustaining job of filtering and returning to the bloodstream about 200 quarts of fluid every 24 hours. About 2 quarts are removed from the body in the form of urine, and about 198 quarts are recovered. Urine we excrete has been stored in the bladder for anywhere from 1 to 8 hours. Kidneys are essential for homeostasis, maintaining a constant internal environment of the body's extracellular fluids that perform the following functions. Excretion of waste and toxins. The kidneys filter out a variety of water-soluble waste products and environmental toxins into the urine for excretion. Remove drugs from the body, balance the body's fluids, and regulates key ions such as sodium, potassium, and calcium. Kidneys produce erythropoietin, which stimulates red blood cell synthesis, and renin, which helps control salt and water balance and blood pressure. They are also involved in regulating plasma calcium and glucose levels. Lastly, it produces an active form of vitamin D that promotes strong, healthy bones. What are some of the causes of chronic kidney disease? Chronic kidney disease is defined as having some type of kidney abnormality or markers such as protein in the urine and having decreased kidney function for 3 months or longer. There are many causes of chronic kidney disease. The kidneys may be affected by diseases such as diabetes and high blood pressure. Some kidney conditions are inherited, run in families. Others are congenital. That is, individuals may be born with an abnormality that can affect their kidneys. The following are some of the most common types and causes of kidney damage. Diabetes is a disease in which our body does not make enough insulin or cannot use normal amounts of insulin. This results in high blood sugar level which can cause problems in many parts of your body. Diabetes is leading cause of kidney disease. High blood pressure, also known as hypertension, is another common cause of kidney disease, and other complications such as heart attacks and strokes. High blood pressure occurs when the force of blood against your artery walls increases. When high blood pressure is controlled, the risk of complications such as chronic kidney disease is decreased. Glomerulonephritis is a disease that causes inflammation of the kidneys' tiny filtering units called the glomeruli. Glomerulonephritis may happen suddenly, for example after strep throat, and the individual may get well again. However, the disease may develop slowly over several years and it may cause progressive loss of kidney function. Polycystic kidney disease is the most common inherited kidney disease. It is characterized by the formation of kidney cysts that enlarge over time and may cause serious kidney damage and even kidney failure. Other inherited diseases that affect the kidneys include Alport syndrome, primary hyperoxaluria, and cystinuria. Kidney stones are very common, and when they pass, they may cause severe pain in your back and side. There are many possible causes of kidney stones, including an inherited disorder that causes too much calcium to be absorbed from foods and urinary tract infection or obstructions. Sometimes medication and diet can help to prevent recurrent stone formation. In cases where stones are too large to pass, treatments may be done to remove the stones or break them down into small pieces that can pass out of the body. Urinary tract infections occur when germs enter the urinary tract and cause symptoms such as pain or burning during urination and more frequent need to urinate. These infections most often affect the bladder, but they sometimes spread to the kidneys and they may cause fever and pain in your back. Congenital disease may also affect the kidneys. This usually involves some problem that occurs in the urinary tract when a baby is developing in its mother's womb. One of the most common occurs when a valve-like mechanism between the bladder and the ureter fails to work properly and allows urine to back up to the kidneys, causing infections and possible kidney damage. Drugs and toxins can also cause kidney problems. Using large numbers of over-the-counter pain relievers for a long time may be harmful to the kidneys. Certain other medications, toxins, pesticides, and street drugs such as heroin and crack can also cause kidney damage. What are the warning signs of kidney disease? Kidney disease usually affects both kidneys. If the kidney's ability to filter the blood is seriously damaged by disease, waste and excess fluid may build up in the body. Although many forms of kidney disease do not produce symptoms until late in the course of the disease, there are 7 warning signs of kidney disease. 1. High blood pressure, irregular heartbeat, weakness and fatigue. 2. Shortness of the breath, nausea. 3. Blood or protein in the urine. 4. A creatinine and blood urea nitrogen blood test outside the normal range. And creatinine are waste that build up in your blood when your kidney's function is reduced. 5. A glomerular filtration rate less than 60 is a measure of kidney function. 6. More frequent urination, particularly at night, difficult or painful urination. 7. Puffiness around eyes, swelling of the hands and feet. How is chronic disease detected? Early detection and treatment of chronic kidney disease are the keys to keeping kidney disease from progressing to kidney failure. Some simple tests can be done to detect early kidney disease. They are a test for protein in the urine. Albumin to creatinine ratio estimates the amount of albumin that is in your urine. An excess amount of protein in your urine may mean your kidney's filtering units have been damaged by disease. One positive results could be due to fever or heavy exercise, so the doctor will want to confirm your test over several weeks. A test for blood creatinine. Your doctor should use your results along with your age, race, gender, and other factors to calculate your glomerular filtration rate. Your GFR tells how much kidney function you have. Each patient is classified into one of the following 5 stages of CKD because management and prognosis varies according to the progression of damage. Stage 1. Kidney damage with normal or increased GFR over 90 ml over mean. Stage 2. Mild reduction in GFR 60 over 89 ml over mean. Stage 3. Moderate reduction in GFR 30 to 59 ml over mean. Stage 4. Several reduction in GFR 15-29 ml over mean. Stage 5. Kidney failure. GFR is less than 15 ml over mean over 1.73 m2 or dialysis. It is especially important that people who have an increased risk for chronic kidney disease have these tests. You may have an increased risk for kidney disease if you have advanced age, have diabetes, have high blood pressure, have heart failure and liver disease, certain cancers, and their treatments have family member who has chronic kidney disease. Being hospitalized, especially for a serious condition that require intensive care. If you are in one of these or think you may have an increased risk for kidney disease, ask your doctor about getting tested. Can kidney disease be successfully treated? Several kidney disease can be treated successfully. Cautious control of disease like diabetes and high blood pressure can help inhibit kidney disease or keep it from getting worse. Kidney stones and urinary tract infections can frequently be treated successfully. Unfortunately, the particular causes of some kidney disease are still unknown and detailed treatments are not yet accessible for them. Occasionally, chronic kidney disease may progress to kidney failure, requiring dialysis or kidney transplantation. Treating high blood pressure with a special medication called angiotensin-converting enzyme inhibitors frequently support to slow the progression of chronic kidney disease. Other research is being done to find more effective treatment for all conditions that can cause chronic kidney disease. How is kidney failure treated? Kidney failure may be treated with hemodialysis, peritoneal dialysis, or kidney transplantation. Treatment with hemodialysis, the artificial kidney, may be performed. It's frequently performed 3 times a week. Peritoneal dialysis is generally done daily at home. Continuous cycling peritoneal dialysis requires the use of a machine, while continuous ambulatory peritoneal dialysis does not. A kidney specialist can explain the different approaches and help individual patients make the best treatment choices for themselves and their families. Kidney transplants have high success rates. The kidney may come from someone who died or from living donor who may be a relative, friend, or possibly a stranger who donates a kidney to anyone in need of a transplant. Prevention acute kidney failure is frequently hard to foresee or avoid, but you may lessen your risk by taking care of your kidneys. Focus on the labels when taking over-the-counter pain medications. Adhere to the directions for OTC pain medications such as aspirin, acetaminophen, Tylenol, ibuprofen, Advil, Motrin IV, and naproxen sodium. Taking a lot of these medications may build and may increase your risk of kidney injury. This is particularly evident in the event that you have previous kidney illness, diabetes, or high blood pressure. Work with your doctor to oversee kidney and other chronic conditions. If you have kidney disease or another condition that increases your risk of acute kidney failure, such as diabetes or high blood pressure, stay on track with treatment goals and follow your doctor's recommendation to manage your condition. Live a healthy lifestyle. Be active, eat sensible, maintain healthy weight, reduce salt intake, don't smoke, and limit alcohol intake.